about mouthwash. And one of the most common questions I get asked from my patients is that whether I should be using mouthwash every day or not. The short answer is no, you shouldn't be. The reason why patients ask me about these questions is because they realize that they haven't been able to clean their teeth very well, and they're asking because they want to know if there's anything else they can do to make their cleaning around their mouth better. If you go back to the videos that I explained about brushing teeth, okay, you realize that the point of cleaning the teeth is to get rid of the plaques around the teeth. Now, I always explain to my patients using the analogy that when you have a very dirty clothes and you're trying to clean it by putting in a washing machine and slap some chemicals onto the clothes, you find a lot of time when the clothes come out of the washing machine, it's still dirty. When something is really dirty, a lot of time you need to use physical or mechanical scrubbing or cleaning to get these things off. And that's no different to the plaques around the teeth, because these film are quite sticky and mouthwash are not going to clean these things off. And certainly when these plaque becomes hard like these things, that we call tartar, that is built up around the teeth, mouthwash is not going to do anything to it at all. Now, having said that, okay, there are still some mouthwash that are quite useful, but in general, it's not something that you use every day. Let's go through some of the example. Now, these ones are the most commonly prescribed ones, okay, and they are chlorhexidine mouthwash. Now, chlorhexidine is a product that you'll see it in hospital a lot in the hand wash, on surgical scrubs and things like that. They're very good at preventing the growth of bacteria. Now, we tend to get patients to rinse with this mouthwash a lot, but usually it's very situation specific. For example, if you had a tooth out after the extractions, it's very good to use this mouthwash afterwards to try to prevent the infections of the area. Or if you had a really bad gum disease, usually after you had the professional clean the first time, the gum tend to be a little bit sore, a little bit raw. Some people do use this mouthwash the week after, just to help limit the bacteria when they aren't able to clean around their teeth very well, because it's quite sore after the clean. Now, keep in mind, these mouthwash is not something that you should be using every single day, because there's some side effects as well. For example, you can start to get the taste change in your mouth, and sometimes it stains the teeth. But it's really useful to use at a specific situation. The second mouthwash that we think could potentially be useful is what we call fluoride-containing mouthwash. Fluoride has been there for a long time. It's in your toothpaste as well. Pretty much most of the toothpaste will have fluoride in there. And the reason behind that is that when fluoride goes into your mouth, it makes your teeth more resistant to acid attack. And the most common problems in your mouth tend to be dental decay or holes in your teeth. And that's come from acids that's built up by the bacteria that cause a hole in your teeth. So when you have fluorides in your mouth, it makes your teeth more acid resistant, and you tend to get less holes in your mouth. Now, if I'm being completely honest with you, the fluoride containing mouthwash can be useful, but it's not something we generally recommend to our patients to use every day. Because when you have a mouthwash to use every single day, it adds one more things for you to do in your daily routines. Whereas if you're someone who have high risk of getting decay, instead of the mouthwash, we generally recommend to up the fluoride concentrations in the toothpaste. So something like this, the NutriFluor 5000s, will have 5 times the fluoride content as a normal stock standard toothpaste that you find in supermarkets or something like that. And that way you can swap out the toothpaste, and then you don't have to do anything extra in your daily routine, and you still get the benefit of more fluoride. The last one is a very interesting one. Now, I can tell you that out of all the things that you could be doing every day, this one is pretty good and it's pretty cheap, okay? And it's bicarb soda. A lot of time people ask me that, okay, if I have a lot of sweets or I have like soft drinks or something like that, should I be rinsing my mouth out with the water? And the idea behind that is that you neutralize the acid. Now, when you have bicarb soda rinse, it's alkaline. That will neutralize out the acid even better than water. So if you're someone who's worried about having holes around your teeth, you can have a glass of water, add a teaspoon of bicarb soda, and then you can rinse your mouth after you have something to eat, and that can be really good. Now, it's really cheap, it's really effective, but why doesn't people do it? Because it's probably not the best tasting thing, but nonetheless, it could be something that you can use around the house. So these are the potential useful 3 mouthwash. I hope this information has been useful, okay, and we'll see you at the next video.